Welcome to our exploration of a critical issue in global healthcare, balancing innovation and access to medicines. As new treatments and drugs emerge, the challenge is ensuring that these innovations reach those who need them most. Today we'll dive into how pharmaceutical breakthroughs are changing lives, but also examine the barriers that prevent equitable access. This journey will reveal the complex interplay between scientific progress, affordability, and policy. Let's begin by understanding why this balance matters for patients, healthcare providers, and society as a whole. Innovation in medicine refers to the development of new drugs, therapies, and technologies that improve health outcomes. These advancements often result from years of research and significant investment. Pharmaceutical companies, researchers, and universities collaborate to push the boundaries of what's possible, bringing hope to patients with previously untreatable conditions. However, innovation is not just about creating something new, it's about making a meaningful impact on people's lives. Next, we'll look at how these innovations are funded and the role of patents in encouraging progress. Developing new medicines is a costly and risky process. Funding comes from a mix of private investment, government grants, and public-private partnerships. Pharmaceutical companies invest billions in research and development, hoping to discover the next big breakthrough. Governments often provide incentives and support, recognizing the public health benefits of innovation. Despite the high costs, successful drugs can transform healthcare and generate significant return. But these financial realities also influence how medicines are priced and who can access them. Patents protect new drugs and therapies, giving companies exclusive rights to market their inventions for a set period. This exclusivity allows firms to recoup their investments and fund further research. Patents are essential for encouraging innovation, but they can also limit access by keeping prices high. Once patents expire, generic versions become available, increasing affordability. The balance between rewarding innovation and ensuring access is a central debate in healthcare policy. Price of new medicines is influenced by research costs, patent protection, and market demand. High prices can make life-saving treatments inaccessible to many, especially in low-income countries. Pharmaceutical companies argue that pricing reflects the value of innovation and the need to fund future research. Governments and advocacy groups push for lower prices and greater transparency. Striking a balance between fair pricing and rewarding innovation remains a challenge worldwide. Access to medicines varies dramatically across countries. Wealthier nations often have better healthcare infrastructure and can afford new treatments, while poorer regions struggle with limited resources. International organizations work to bridge these gaps, but disparities persist. Factors like supply chains, regulatory approval, and insurance coverage all affect who receives innovative medicine. Addressing these challenges requires coordinated efforts from governments, industry, and global health agencies. Before new medicines reach patients, they must pass rigorous regulatory checks. Agencies like the FDA and EMA evaluate safety, efficacy, and quality. These processes protect public health but can delay access to innovative treatments. Streamlining regulations without compromising safety is a key goal for policymakers. Collaboration between regulators and industry can help speed up approvals and ensure timely access to life-saving drugs. Improve access, various affordability solutions are being explored. These include tiered pricing, subsidies, and partnerships with generic manufacturers. Governments negotiate prices and sometimes provide financial assistance to patients. Nonprofit organizations also play a role distributing medicines in underserved areas. Innovative pricing models aim to make treatments affordable while sustaining investment in research. The effectiveness of these solutions depends on local context and global cooperation. Generic medicines offer affordable alternatives once patents expire. They contain the same active ingredients as branded drugs and are equally effective. Generics increase competition, driving prices down and expanding access. Governments encourage generic production to reduce healthcare costs. However, challenges like manufacturing quality and regulatory approval remain. Generics are a vital part of balancing innovation with access, ensuring more people benefit from medical advances. Innovative medicines have transformed public health, curing diseases and improving quality of life. Vaccines, antibiotics, and cancer therapies are just a few examples. However, their impact depends on widespread access. When only a few can afford new treatments, health inequalities widen. Ensuring that innovation benefits everyone is crucial for building healthier societies. Public health policies must prioritize both scientific progress and equitable distribution. Nonprofit organizations are instrumental in expanding access to medicines. They negotiate with pharmaceutical companies, distribute drugs in low-income regions, and advocate for policy changes. By focusing on patient needs rather than profits, these groups help bridge the gap between innovation and access. Their work complements government and industry efforts, ensuring that vulnerable populations receive life-saving treatment. Collaboration between pharmaceutical companies, governments, and NGOs is key to improving access. Partnerships can lead to joint research, shared funding, and coordinated distribution. By working together, stakeholders can overcome barriers and accelerate the delivery of innovative medicines. These alliances are especially important during health emergencies, when rapid response is needed. Building strong partnerships ensures that innovation reaches those who need it most. Patients and advocacy groups play a vital role in shaping access policies. They raise awareness, lobby for affordable pricing, and push for faster regulatory approvals. By sharing their stories, patients highlight the real-world impact of innovation and access barriers. Their voices influence policymakers and industry leaders, driving change that benefits the wider community. Empowering patients is essential for achieving a balanced healthcare system. Technology is revolutionizing how medicines are developed and delivered. Digital platforms streamline research, telemedicine expands access, and data analytics improve patient outcomes. Mobile apps help patients manage their treatments and connect with healthcare providers. Technology also enables remote monitoring and faster diagnosis, making healthcare more accessible. Embracing digital innovation is vital for bridging gaps in access and maximizing the impact of new medicine. Policymakers are exploring various solutions to balance innovation and access. These include price controls, patent reforms, and incentives for generic production. International agreements aim to harmonize regulations and promote fair pricing. Effective policies require input from all stakeholders, including patients, industry, and governments. By crafting thoughtful regulations, policymakers can foster innovation while ensuring medicines are affordable and widely available. Fight against HIV offers a powerful example of balancing innovation and access. Early treatments were expensive and limited, but advocacy and partnerships led to affordable generics and widespread distribution. Today, millions benefit from life-saving antiretroviral drugs. This case shows how coordinated efforts can overcome barriers and ensure that innovation reaches those in need. Lessons from HIV treatment inform strategies for other diseases. Emerging markets face unique challenges in accessing innovative medicines. Rapid population growth, limited infrastructure, and economic constraints make it difficult to deliver new treatments. Pharmaceutical companies are adapting strategies such as local manufacturing and tiered pricing to meet these needs. International support and investment are crucial for improving healthcare in these regions. Addressing emerging market challenges is key to global health equity. Rare diseases often lack effective treatments due to limited market size. Recent innovations have led to breakthroughs, but high costs and small patient populations pose access challenges. Governments and industry are exploring incentives for research and ways to subsidize treatments. Patient advocacy is strong in this area, pushing for faster approvals and affordable pricing. Balancing innovation and access for rare diseases requires creative solutions and sustained commitment. COVID-19 pandemic highlighted the importance of balancing innovation and access. Rapid vaccine development was a triumph of scientific progress, but global distribution faced significant hurdles. Wealthier countries secured supplies quickly, while poorer regions waited. International cooperation, technology transfer, and flexible pricing helped improve access. The pandemic response underscores the need for preparedness and equity in future health crises. Ethics play a central role in decisions about innovation and access. Should life-saving medicines be reserved for those who can pay or made available to all? Balancing profit motives with social responsibility is a constant challenge. Ethical frameworks guide policymakers, industry, and healthcare providers in making fair decisions. Transparent processes and public engagement are essential for building trust and ensuring equitable outcomes. Incentives drive innovation in medicine. Governments offer tax breaks, grants, and fast-track approvals to encourage research. Pharmaceutical companies invest in cutting-edge science motivated by potential rewards. Balancing these incentives with policies that promote access is crucial. Too much emphasis on profit can limit affordability, while insufficient rewards may slow progress. Finding the right mix ensures continued innovation and broader access. Transparency in medicine pricing is vital for building trust and improving access. Patients, governments, and advocacy groups demand clear information about how prices are set. Greater transparency can lead to fairer pricing and more informed policy decisions. Pharmaceutical companies are beginning to share more data, but challenges remain. Open dialogue is essential for balancing innovation with affordability. International agreements shape how medicines are developed, priced, and distributed. Treaties like TRIPS set rules for patents and trade, influencing global access. Countries negotiate to protect their interests and promote public health. Harmonizing regulations and sharing best practices can improve access worldwide. International cooperation is essential for tackling global health challenges and ensuring innovation benefits all. Future of medicine will be shaped by ongoing innovation and efforts to improve access. Personalized treatments, gene therapies, and digital health tools are on the horizon. Policymakers, industry, and patients must work together to ensure these advances are affordable and widely available. Anticipating challenges and embracing new solutions will be key to building a healthier, more equitable world. Balancing innovation and access is a dynamic process. Stakeholders must constantly adapt to new challenges and opportunities. Collaboration, transparency, and ethical decision-making are essential. By prioritizing both scientific progress and equitable distribution, we can ensure that medicines transform lives everywhere. The journey is ongoing, but the goal remains clear: health for all. Community engagement is vital for successful healthcare initiatives. Local leaders, healthcare workers, and patients collaborate to identify needs and solutions. By involving communities in decision-making, policies become more effective and responsive. Grassroots efforts can drive innovation and improve access, ensuring that medicines reach those who need them most. Community voices are a powerful force for change. Education and awareness campaigns help patients understand their options and advocate for better access. Healthcare providers educate communities about new treatments and preventive care. Awareness empowers patients to make informed choices and demand fair pricing. By spreading knowledge, we can bridge gaps and ensure that innovation benefits everyone. Measuring the impact of innovation and access policies is essential for continuous improvement. Data collection, patient feedback, and outcome tracking help identify what works and what needs adjustment. Governments and industry use these insights to refine strategies and maximize benefits. Transparent evaluation ensures accountability and drives progress toward health equity. Sustainability is key to balancing innovation and access. Long-term solutions require ongoing investment, policy support, and community involvement. Sustainable models ensure that medicines remain affordable and available, even as new challenges arise. By focusing on lasting impact, stakeholders can build resilient healthcare systems that serve everyone. Balancing innovation and access to medicines is a complex but essential task. By fostering collaboration, transparency, and ethical decision-making, we can ensure that scientific progress benefits everyone. The journey involves many stakeholders, from researchers and industry to patients and policymakers. Together, we can build a future where innovative medicines are accessible, affordable, and transformative for all.